Now look at the person on your right and look at the person on your left. Now just imagine if one of them suddenly collapses, falls on the floor and becomes unresponsive. Now what if I tell you, if that person not attended to urgently dies?
This sounds really scary, but you know what? This happens all the time. This is sudden cardiac death, and approximately 10% of Indians all over the country die from this condition each year.
Up till now, we never really knew what preceded sudden cardiac death, but now we may have some data.
So today, on this very special segment, we are going to show you something that may actually help you save somebody's life. I'm Dr. Sonalal Gupta.
And I'm Dr. Samir Gupta. Welcome to Doctors on Call. A recent study published in Annals of Internal Medicine studied almost 1,000 patients who had sudden cardiac death. Unfortunately, around 100 people actually survived the event. A detailed analysis was done of the medical records that included information given by family members, bystanders, and their friends. They found that almost 50% of patients had some complaint up to 4 weeks leading to the actual event, and they typically recurred 24 hours before the event. These complaints were most frequently chest pain, shortness of breath, an irregular beating of the heart, passing out, or a feeling of general unwell-being. A majority of these patients had some risk factor that included diabetes, blood pressure, smoking, or obesity. But what is interesting is that most of the patients who had complaints also had these complaints in the last week, and in some cases even the month leading up to the event. But in most cases, they went ignored and unattended. So the good news is that most people have some warning sign for sudden cardiac death. But the bad news is that most people also ignore it. It is important for us to take care of our health and pay attention to these small signs, which may be a sign of something bigger.
But the big question is, what to do when somebody collapses in front of you? So today we're going to demonstrate to you CPR or cardiopulmonary resuscitation. We are going to suppose that this mannequin is somebody who has suddenly collapsed in front of us, and Samir is going to show you what are the steps you can take to help this person.
So CPR, also called cardiopulmonary resuscitation, is an emergency life-saving maneuver that you can utilize to save somebody's life. So when somebody collapses in front of you, the first and foremost thing you do is you ask for help. You call your neighbor, call a friend, preferably call an ambulance. We should all have an emergency contact number on our phones, on our landlines, somewhere stored with us. We don't know when we may need it. The second thing you do is you lay the patient down on his back and you check for his consciousness. So what you can do, I'm going to assume this is the person. You wake him up, slap his face around a little bit, maybe throw some water if you want. See if the person is conscious, if the person is responding or not. Then you check for breathing. The way you can do that, normally when you breathe, your chest goes up and down. You can see if the chest is going up and down or not. You can take your hand, put it around his face, around his nose, see if you can feel for any breath. Then you take your ear, you can put a ear around his face, see, can you feel for any air? Is this person breathing or not? So if the person is not responding, he or she is not breathing, then you check for the third thing. Step 3 is you check for the pulse. The way you check for the pulse is you take a finger, you put it right here in your neck. You should be feeling a pulse. If you don't feel a pulse here, the other place to check for a pulse is in your hand, right on the side of the thumb. Take 2 fingers, you should feel for a pulse. So supposing this person is not responding, is not breathing, and does not have a pulse, then it is time to start CPR. CPR, the way you do it is you take your left hand, lock your right hand with it. Then you take the palm, you take the base of your hand and you use it for compression. You use it in the center of the chest. You compress at the center of the chest. The center of the chest is a line from your belly button or umbilicus down up to your neck in a vertical section. On the side is where the 2 nipple lines meet. That is the center of the chest. So you take your hands, lock it, put it over here, use your entire body weight, and you start compressing.
So the important thing to know that you should do 100 compressions a minute. And as you can see over here, Samir is putting all his body weight, compressing the heart perfectly. You can see the compressions. You can see how the spring action of the chest. This is really important. A lot of people are worried, what if the ribs crack? Please don't worry about that. At this point, the most important thing is to save somebody's life.
It is important for us to do, like Sonia said, it is important to do this at 100 times a minute and keep doing it till either the person has some signs of movement, medical help arrives, or somebody else comes out to help you, or if you get tired. And this maneuver can actually help save somebody's life. I hope you all learned something new today. I pray you never have to use it, but if you do, you'll be saving somebody's life. Thank you for watching.
See you next week.